Mike, sorry to interrupt your reading here, but I got some more questions for you.
Okay.
What was the turning point in you deciding to turn your one practice into what AMI is now?
Well, when I first changed it to an integrated practice, that was a pretty big decision because I was a straight chiropractor, meaning I only did straight chiropractic. And we wanted to work together, Colleen and I. My wife's a physical therapist, so to work together, we had to actually make sure it was okay in that state. And in Pennsylvania, it's one of the few states where a physical therapist cannot work under the order of a chiropractor. So the reason we brought in medical people is so we could work together, because we were trying to use upper cross and lower cross syndrome type of rehab that helps people adjust their posture back to normal after they get a spinal problem corrected. And we had to have a medical doctor order the physical therapy, so we started looking at working with a medical doctor, which I was hesitant to do, but it turned out to be the best thing I ever did. Because I found out many medical doctors are very much looking for the best solutions for their patient and as much avoidance to drugs and surgery as possible. So that's why we work well together.
That's amazing. If you could go back in time, what type of things would you do differently in starting your business?
If I could go back in time, I actually think I would say nothing, but if you need an answer for that, let me think about it. I like the way I started because I had no money when I started, and I had to actually figure out how to get the financing I needed to start, and that made me become resourceful. And then it really lit a fire under me because I had mouths to feed and they were depending upon me, and it really incentivized me to work hard. So I had a very, very large chiropractic practice and then a very, very large and successful integrated practice. So I don't know if I would actually change anything.
What are 3 things to consider in building a business?
Well, there's 3 things to consider in business. Any business, whether it's healthcare or anything, is flow, conversion, and retention. And that is a flow of new customers into your business, converting them from a prospect into an actually customer by having them purchase something, and then retention, having them stay with you because they like the service or product that they bought from you. They're the 3 main things you have to consider in running a business.
Almost like the 3 Musketeers?
Almost like the 3 Musketeers.
What are the 5 key elements for building a successful business?
I got this from a mentor of mine, Brandon Dawson, and the 5 key elements in running a business successfully, and especially as you get bigger, these become more and more important, and that would be marketing, finances, operations, HR, and employee development. And each of those play their own individual role. The bigger you get, the more you start to lean into these different areas. Most doctors are not business people, and they don't understand those 5 things. They understand the trade that they have or what they do, but not really how they do it and who they do it with. And as you get bigger, if you become successful, you have to know how to do it with others, and you have to know who to do it with. So that's where HR and employee development, which is the least known and the most important as you get bigger, and that's training your employees. And then handling and understanding your finances and operations, how to operate effectively. Because as you get big, your overhead can get gigantic, and if you're not efficient, it'll eat up all the profits. So, you have to make the reward worth the risk, or the risk worth the reward. So basically, you have to pay attention to those 5 areas if you're going to be successful.